Good morning. Welcome. I'm Maureen O'Connor, president of Palo Alto University, and I'm delighted to welcome you today to our webinar. Palo Alto University is dedicated to addressing the pressing and emerging issues through research and training in the fields of psychology and counseling. My pleasure to welcome you to our webinar series, At the Forefront of Mental Health. Today's discussion focuses on parents and families and the many mental health challenges they have faced during the pandemic and continue to face as they navigate their way to what is being called a new normal. Our expert panel of mental health professionals will take an inside look at this pressing issue and offer tips and advice to help parents in this uncharted course. And I'm delighted here to moderate the discussion is ABC 7's news reporter, Kate Larson. For the last year, Kate's reporting has focused on the pandemic and includes a recent groundbreaking story on the unprecedented impact COVID-19 is having on teen mental health. Kate, we are delighted to have you here today to lead this important discussion.
Well, thank you so much, President O'Connor, and everyone from Palo Alto University for inviting me to be a part of this very important and meaningful program. I know we're going to have a really insightful conversation, and I'm really looking forward to it. I am a parent myself, and I've spent much of the past year speaking to families throughout California with a focus on mental health. So I do know how challenging this past more than a year now has been for so many families, parents, students, young children throughout the Bay Area and throughout California. So I really hope that this conversation can provide some meaningful resources and tools for all of us to move forward in a healthy way. Before we begin, we do have some housekeeping items. This discussion will be recorded and a link will be sent to you within the coming days or week. And we will have time for some questions at the end. So go ahead, keep your questions in mind, and then you can use the Q&A function at the bottom of your screen to write in your question. And if it is for a specific panelist, please do indicate that, and we'll try and get to those questions in the last 15 or 20 minutes or so of this event. Of course, the most important item of business is we need to introduce our esteemed panel of experts. Margaret Lamar is a Palo Alto University professor and researcher specializing in maternal mental health. Last March, April, she conducted a study on the impact of the pandemic and what it was having on parents and families. Ramsey Cascio is a chief clinical officer at Palo Alto's Children's Health Council, which is an education and mental health resources and service center for children's, teens, and young adults in Palo Alto. Dania Wallace is a private practice clinician and assistant visiting professor at Palo Alto University. She focuses on social historical trauma of African-American women in healthcare. And Jamie Kent is a clinical psychologist and assistant professor at Palo Alto University with a focus on women's mental health. We are going to divide this discussion into 4 segments. We have 3 discussion topics, and then the last will be our Q&A. So our first segment is, how has the pandemic impacted the mental health of parents and families? And Dr. Lamar, we'd like to start with you. Can you tell us what your study involving the mental health of parents at the beginning of this pandemic revealed?
Absolutely. Thanks, Kate. I'm so excited to be here. I'm also a parent of 2 young kiddos, and I surveyed parents last March and April. Our research team did, to look at mental health, alcohol, substance use, and parenting attitudes at the very beginning of the COVID-19 response. And what we found were a lot of concerns around mental health. A significant number of our participants had severe levels of stress and depression, and an extreme extremely severe level of anxiety. And so just to put that into context, typically you'd see folks in the mild range for stress, depression, and anxiety. So that was a huge jump. And if you just, remember last March and April, it was an extremely stressful time and there was not a lot of resources available for folks. We also found that about 75% of our participants reported consuming alcohol, and that's a lot higher than what we typically see in the population, which is around half of U.S. adults, and about 25% of them had problem alcohol usage. So a lot of concerns there. We also saw that a little under half of them indicated using substances. That's again higher than what we would typically see prior to COVID. And the CDC just reported that overdose deaths last year were about 30% higher than in previous years. And there was specifically a surge in April and May when those stressors were really high and treatment options were really limited because of all of the closures and quarantine measures that were in place. We also found just some interesting things around parenting. During April and May, there was this really heightened belief, especially among mothers, that moms are sort of the most essential and necessary caregiver for children. So a lot of reliance upon moms was happening last year. And, if you remember, like, everything was closed, school was closed, getting food was really challenging, and yet mothers were still really seen as that primary emotional support. We also saw that, mothers saw parenting as more challenging during those months. And a really interesting finding that we saw was that the longer schools were closed, attitudes about parenting being challenging and the idea that moms are the better caregiver, the longer schools were closed, the more that went back to pre-COVID levels. So it was interesting to us because we saw this implication around the resiliency of mothers, that they adapted to all these changes really quickly and were like, this isn't a big deal. I'm juggling all of these things and, this kind of becomes normal again. But what we saw in the mental health results is that it really was a big deal. On the surface, maybe it seemed to moms like they were adapting and doing really great, but we saw some really concerning depression, stress, and anxiety levels with those moms.
Absolutely. And it's so difficult when the school's closed. I remember that so well because you're thinking, how on earth does a parent who has a full-time job and now a kid who can't stay home alone manage to juggle all of those responsibilities? Was that the primary stressor for moms and dads?
Yes. I mean, there were so many stressors. We also, we saw people losing jobs, challenges accessing medical care, a lot of fear around COVID was so, we just knew so little at that time. And yet we saw various countries and parts of the United States seeing really severe results around COVID. So there was a lot of fear around that. Of course, schools being closed, parents having to work from home and manage their schools, manage their kids' school and all of that. There was just so much. And yet, we didn't really know what was coming. And so it kind of kept being like, remember last spring break when we all thought, schools are going to just be closed an extra couple of weeks and we'll all go back and everything will be fine. And then it felt like, okay, now we're starting to see like, maybe we might not go back till the end of April. And then hearing the news like, we're actually not going back until the fall. It just kept feeling like there was disappointment after disappointment and there was very little hope to hold on to.
Absolutely. And we haven't seen a lot of hope until recently with the vaccines improving.
Mm-hmm.
Dr. Cascio, that leads us to you and your work at the Children's Health Council. Can you share some of the current data that you've discovered on how the pandemic is impacting the mental health of children, teens, and adults?
Yeah, absolutely. And as we get that slide up, I do want to mention, and Kate, you alluded to this, which is, while the majority of the impact is due to COVID-19, we also have to remember that there's been multiple stressors over this last year. We dealt with a pandemic. We're still dealing with that. We've dealt with an awakening around systemic racism, the political divide, wildfires here in California. So there's been a tremendous amount of stress for all of us, and particularly for parents. And what the data is showing us is, if you look at the statistics here, about 25% of parents say that they could have used some emotional support. The other way that I read this is about 75% of parents say that they've emotionally struggled during this time. That's a lot of people. About a third of those parents have actually reached out and received treatment for their mental health struggles. And about a quarter of them were actually diagnosed with a mental health disorder. So we're really seeing the impact on parents. If you looked at the other numbers, 62% of parents whose children are still learning from home doing remote learning. This is a really important number as we think about things starting to reopen, hybrid models happening at school, even parents being asked to return to the brick and mortar office. What that is going to look like in terms of parents returning, but kids still having to do distance learning from home, having other people step in to support parents. This has been an incredibly challenging time for parents and has created a tremendous amount of stress, as Dr. Lamar has indicated.
Well, and Dr. Cascio, I know you have even more data, which is so helpful when we look at this issue in a big picture perspective about what the data is showing for parents. Absolutely.
And so anybody who is a parent knows that part of the parent stress is helping your child or your teen or even your young adult navigate their own stress. So this data is the data related to the impact of COVID-19 and the other stressors we discussed on youth. As a whole, prior to the pandemic, the rates of mental health challenges were about at 20%. Post-pandemic, that number has tripled. So we're seeing about 70 to 75% of young people who are struggling, endorsing things like anxiety, depression, isolation. So that 74% data that school districts report, that's a good kind of national average for young people who acknowledge that they're really struggling with their mental health during this time. I do want to point out that 80% number of college students reporting that COVID-19 has negatively impacted their mental health. When we think about kids, we oftentimes think about young children or even teens, but there's a very vulnerable population. We call them the transitional age youth. This is the age of about 14 to 24, 25. Young adults, they're pretty vulnerable. They're in that very challenging place between, being still a child in many ways and launching into adulthood. And we see that, and their mental health is very vulnerable. We've heard stories about young people who have not been able to return to college. They've not been able to find jobs because of the economic impact, having to move back home with their parents because they've been unable to find jobs or their mental health has been impacted. This is a very vulnerable population that I think is important to remember when we talk about kids and young people who've been impacted. We've also seen a surge and increase in the higher risk population. So young people who've been engaging in self-harm or suicidality. The local hospitals are reporting about 150% increase to inpatient hospital rooms, emergency room visits for young people who are really struggling with those high risk issues. The other thing I wanted to note that's really important is that our communities of color have been disproportionately impacted by positive COVID-19 rates. And in addition to that, they've also been disproportionately impacted by mental health as well. And you'll see the data there that African-American youth suicide rate is double that of their peers. So we're seeing a really significant impact on all people, young people, parents. And while this data is important, we definitely don't want to be alarmist about it. Many of our young people and our parents are very resilient, but it is really incredibly important to look at the data and see the effect that the pandemic and other stressors are having on our communities.
Absolutely, Dr. Cascio. I think that's a really important point that we want to be helpful in this conversation. And I think having this conversation is an excellent step to hopefully at least bring these issues to light. And Dr. Kent, we're going to get to you in a moment, but since you brought up the equity issue, Dr. Cascio, I do want to get to Dr. Wallace because equity has been such a huge player in this pandemic with marginalized low-income communities, people of color being hit harder not only by actual COVID cases, but issues when it comes to returning to the workplace, not having extra support when it comes to childcare. And obviously job losses has been a huge part of this pandemic. So what has been the impact of the pandemic to people of color when it comes to mental health? And what are families of color dealing with as far as accessing mental health care, which is difficult for anyone, even with a tremendous amount of resources, and then throw in the fact that you don't have that financial ability to pay for a private therapist or the time to spend all day on the phone. How do folks deal with this?
On mute there. Yeah, so we know that healthcare disparities were present for people of color prior to COVID. And so in the last year or so, what we've seen are those disparities really be highlighted and take center stage when we're having conversations about the impact of COVID. When we look at morbidity rates and mortality rates among people of color, we find that the impact is more severe for people of color than it is for white. Estimates are as high as 2.5% higher death rates among people of color with COVID when you compare them to white individuals. And so many of these disparities we're seeing are, of course, as a result of systemic issues of racism. When we're thinking about employment, the loss of wages, the loss of employment opportunities, those issues have always been present and really have made it impossible in some cases for families to maintain, to stay afloat. Additionally, we've seen some issues with children going back to school because of the increased rates of mortality. There are concerns about children of color returning to school full time, increasing exposure to COVID, and then bringing that home. What is going to be the impact on those families in situations like that? And so when it comes to accessing care, one of the problems that we see and have seen prior to COVID, but it's just being magnified now, is the lack of quality services when it comes to mental health. People of color tend to have needs that are specific to their cultural experiences, specific to the impact of social injustice and issues of racism, gendered sexism, for example, that need to be handled in therapeutic settings by a clinician who has knowledge of these factors and the ability to treat them in a way that is culturally responsive. We've seen a lot of grief, unfortunately, associated with the loss of jobs, the loss of family members. And so one of the ways historically that people of color have addressed grieving has been to come together collectively, right? So we, funerals are held with lots of family members. Typically family members visit with one another in their homes after funerals and things like that. That has not been able to occur, right? And so the traditional ways of healing have kind of been uprooted. And now, so there is just a lack of those kind of traditional healing responses, but then also that lack of access to quality treatment continues to be a factor.
Absolutely. Thank you so much for all that important insight, Dr. Wallace. I hope to talk more about the equity issue as we move through this program. But I do want to turn our attention to Dr. Kent because you focus on maternal mental health. What have you learned about the impact of the pandemic on the women you work with?
Yeah, thank you. I feel like just having heard Margaret's study and the results from last spring has been really consistent. Her results are very consistent with what I've seen clinically. I work only with women, and so many mothers, and I've seen heightened anxiety, stress, depression, loss, and grief. And congruent with Margaret's findings, just this morning, in fact, in my email, I had an email about a recently published study in The Lancet, which is a very well-known medical journal. And they were tracking moms and infants for the past decade. This was a longitudinal study looking at these mom and infant pairs over the past decade. And so they had the perspective of being able to say, how was anxiety and stress over this time period and how did it shift during COVID? And they saw that for this past year during the COVID time points, that clinical depression had increased nearly double among these moms, 35% was the rate. And anxiety had nearly tripled to 31%. And then there was about 20% that reported both clinically significant anxiety and depression. And I feel like that's exactly what I've seen in my practice is women really struggling, as Margaret mentioned, to balance these multiple roles that are expected of them. A lot of this is based in cultural and gender role expectations. But moms trying to be moms, good spouses, maybe they have a professional identity, daughters, trying to relate to parents as they're navigating COVID and the pandemic, and holding very high expectations of themselves. I think there are very high expectations that are put on moms that are then internalized. and I think what happened was that the more responsibility women took on during this time was the less time that they had for self-care. And so there was a vulnerability then to developing some of these mental health symptoms. I think that one of the things that I've seen a lot of as well is guilt. Women tend to be very other focused. And so I oftentimes will talk about the difference between thinking about oneself versus other, and moms in particular during this time have been very much conscious of feeling like they need to do more, that their children may be missing out on certain experiences, and trying to create almost an idealistic world within the home during lockdown, which is essentially impossible, as any of us who have children know. And their typical coping strategies, similar to what others have said, were really taken from them. I think women really look to other women for support. And in this period of isolation, those face-to-face interactions weren't as accessible. I will say that the new moms that I work with, both during pregnancy and postpartum, I think were really impacted by that. Pregnancy and postpartum is a time when there's a tremendous amount of physical and psychological vulnerability, and women really need to receive care and support during that time. So I think those women felt particularly stuck by the limited social interaction that they were experiencing. The other thing that I've been noticing more recently is decision-making fatigue, where moms have been extremely vigilant and almost like what we would typically call a trauma response, very vigilant to the environment around them, trying to navigate, what is safe, what is threatening in this world with the data that's constantly a moving target, and trying to figure out, how do I make these decisions? And things that were once neutral or innocuous, like going to the park or going to the grocery store, now became multi-tiered decision-making around, is this safe? Do I bring my children? Do I bring wipes? What if there are other people there? Sort of going through all these different decision-making pieces that created fatigue. And I think that heightened sense of awareness of the surroundings is something that really has created, whether you call it COVID fatigue, some of us have Zoom fatigue, decision-making fatigue, that fatigue is really present for moms right now. So that's what I'm seeing more recently.
I'm so glad you brought up new moms, people who were pregnant or had babies during the pandemic, because that's a time of anxiety regardless, trying to protect a newborn. And I've seen so much of that this past year just within my own community and family about how hard that is. And then, of course, the decision-making fatigue. I don't know about you all, but I remember when the pandemic first started, coming home from work and feeling like I needed to immediately strip down and put all my clothes in a hot wash cycle, because you feel like you're carrying around the virus everywhere and you don't want to, share it with your kids or family. So there's certainly been that heightened anxiety. Now that we've heard from all of you with all of your unique perspectives, I do want to ask each of you to comment on what trends you're witnessing within your particular areas of practice, and what are some of the long-term concerns now from families?
Yeah, I'm happy to chime in here. As Dr. Kent mentioned, we are seeing what folks are referring to as a sort of trauma response. And then, as on one of those slides, we labeled it collective trauma, because we are experiencing a collective trauma in many ways. So trauma by definition is when an individual or group of individuals is negatively impacted by a situation or experience in which their life is threatened or their livelihood or well-being is threatened. And based on all of the stressors that have happened this last year, I think we can all say that we've been impacted in one way or another. Fears about somebody getting COVID, our loved ones dying, et cetera. So, symptoms that we typically see are just an increase in anxiety and fear and worry about their health and well-being. We're seeing a lot of sort of issues related to sleep, lack of sleep, sleeping too much, depression, so low mood, sad mood. At CHC, we're really seeing an increase in referrals, just people who are really struggling on many fronts and just are unable to cope with these symptoms that are coming up and need help. We also have seen a number of young people who we have treated in years past. They've dealt with anxiety, depression, gone through treatment, been successful, have been, not in our system for many years, 6 months, and who've returned to us. Those symptoms have come back, the anxiety, the depression. We've also seen an increase in uptick in some of those higher risk behaviors that we talked about earlier. So suicidality, self-harm behaviors. One of the things that we're seeing and we have to understand is, young kids are just at home, and we're used to, young people being having eyes on them by teachers and coaches, and a lot of adults really looking out for our kids and identifying things that are coming up, and that's just not happening anymore. We're getting a lot of calls regarding family conflict. It's just, we have to face the truth, which is we're just not used to parents being home, kids being home 24/7, work, school, family life round the clock. And that's incredibly stressful. It's difficult not to have those boundaries. Those boundaries are there for a reason. They help keep balance. And things have been really imbalanced this last year. And that has created a lot of family conflict, sibling conflict, marital conflict as well. And parents calling us just in terms of parent struggles with not knowing what to do. Their teen is in their room, isolating, not coming out. Their third grader is emotionally dysregulated, having outbursts, not willing to stay in front of the screen for distance learning. So just a lot of challenges coming to the forefront.
Well, and Dr. Wallace, I'd like to turn to you. I'm also sort of curious, these systemic issues of racism within the healthcare system have existed for generations, if not forever. Do you think the pandemic and bringing these issues to light, to the forefront of everyone's minds, is it all helpful as we move forward and we've at least identified problems that we need to work on solving? Or do you think these issues will persist within communities of color? Does the anxiety increase? Is anything improving?
So acknowledging that the problem exists is certainly the first step. And, obviously, because of COVID, with that light being shown on these disparities, there's no way to deny that it is there and that it has been there. And so when we talk about overcoming and addressing these disparities, we have to understand that these are systemic issues. And so, as much as we as individuals would like to see changes, change needs to begin at the top. And so having conversations within communities about need and engaging in active efforts to dismantle many of the systems that can allow these disparities to continue is certainly one of the many steps that we need to take. But this is an ongoing effort, and the effort is not new. These issues have been here for centuries, honestly. And so the efforts to undo them have been ongoing and certainly will continue. In light of the ongoing civil unrest and, ongoing exposure of issues of police brutality and things of the like, there's almost a balancing act that has to take place, specifically within families of color. Do we divert attention to addressing issues related specifically to COVID? Or should we be placing our attention to those things that are going on around us that directly impact our well-being? And so in sitting, in session with families, often there are multiple issues and many of them have no immediate solutions. There's very little benefit in teaching families and individuals those cognitive strategies that can, help them to improve their mental functioning or some of those sorts of things when there are systemic issues, where there are, food deserts and lack of access to quality healthcare and resources. And so there is a tremendous amount of work to be done, but certainly if there are any benefits to COVID, it's, in my opinion, now that we just cannot ignore what's been here for so long.
Pharmacy deserts too is another issue that's come up within marginalized communities, which is really interesting as we try and ask people to go to pharmacies to get a COVID vaccine. At least here in the Bay Area, I know that all of the healthcare, the counties and the providers have working hard to set up clinics in these communities so people have direct access. So like you said, I'm hopeful that at least this awareness and this heightened conversation will bring about some meaningful change as time goes on. It will clearly take a lot of time. Dr. Lamar and Dr. Kent, since both of you work with women, from each of you, is there one trend that you've noticed among moms, women?
Sure. I mean, I think that, I talked about our study from March and April and that just really heightened level of anxiety. Someone said that Jamie was talking about the hypervigilance. And I think that we've gone through some stages now and we're seeing just sort of this, I think you'll hear the term pandemic wall, right? This kind of burnout that people are hitting of being so vigilant for so long and having so many decisions. I mean, this is all just stuff you talked about, Jamie, like just having to make so many decisions. I mean, I know where I am in the Bay Area, we've been having the like answer this question for the school district so we can figure out distance learning. I mean, we've been taking those surveys like every few weeks since November, right? So it's sort of just keeps, it feels like it just keeps going and going and going of like all these things we have to figure out and do. And you just, you know, if you're working, you never know, moms just never know like how much time they're going to get, right? Because if a kid gets sick now, you know, like if my 3-year-old is at preschool and gets a runny nose, he's out for a week. And then I have to sort of rearrange my schedule and figure all of that out. And you know, that's just what we're seeing with moms having to manage that consistently. And it's starting to feel like, okay, we're really tired and burned out. And so that anxiety and depression that maybe looked one way in March and April, maybe looks now more like just feeling tired a lot, or, you know, feeling overwhelmed and, you know, feeling like you can't make one more decision, or, you know, maybe you're less motivated and so it gets really tricky, but it does just sort of feel like it's this long endurance event that we're in and we don't know necessarily how it's going to end or what that's going to look like, and that is taxing in and of itself.
Dr. Kent.
Yeah, I definitely echo everything that Margaret just said. I think the fatigue is just so present right now, and I'm seeing that in all my clinical cases. And my sense is that the moms that I work with have been in survival mode for a year and really trying to create a sense of normalcy when things are not normal, to protect their family first and their children and then themselves as well. And I'm noticing now that as there is some light, it depends on the day, of course, how much light are we getting from this end of the tunnel? Some days it feels very bright and other days a little bit narrower. But there's now I'm sensing some anxiety and concern around what is the new normal. And I've adapted a bit to this past year, and now I don't know what to expect again. And what happens when things do improve? What does that mean in terms of my routine, my family's routine? And some questioning and honestly, some thoughts that are guilt oriented around, I've been doing so much. What is it going to look like when the expectations shift? And will there be shame, guilt around that? And so that's going to be, I think, an interesting transition for moms who have been really in overdrive this past year. And expectations will shift as things open up a bit more and there's some normalcy to the world around us. The other thing that we haven't talked as much about that I think is important, and another piece that I see in my clinical work here is that, you know, in the Bay Area, San Francisco has the oldest age in terms of women getting married and starting families nationally. And so what that has meant for the women that I see that are moms is that their parents are also in this age range of being quite vulnerable to COVID. And so that's manifested throughout, we call this the sandwich generation, where these women are caregiving for their children, but also potentially taking on a caregiver role for parents. And so that's manifested in a way where at the beginning of COVID, I heard a lot of concern around my parents aren't taking this seriously enough. I feel like I'm parenting them, and sort of shifted now towards being the tech person who is looking for vaccinations for parents and really advocating on behalf of parents in terms of how do I navigate this medical system. So that's something that I've seen more recently in terms of something that moms are currently in the midst of navigating. It looks like our host, Kate, might not be here anymore. If she's back. Margaret, I don't know if you had anything else to add to that.
No, you're good. I was resonating personally with everything you were saying.
Sorry, my internet dropped out for a second, but I'm hopefully back. So You provided the perfect transition, Dr. Kent, because our next segment is talking about where are we now, and then also hopefully some practical advice to families to find the resources that they need to move through this next phase of whatever our new normal is, especially confusing to families as they think about perhaps going back into the office, which I know is top of mind for so many people. So Dr. Kent, I know you wanted to talk about the lack of mental health providers. And I know that that in my reporting is an issue that I come across again and again, because I like to be a part of solution-based journalism. But when the resources aren't there, where do you send people? And what should people do, particularly from marginalized communities, low income communities, people of color who might not have the same access as others?
Yeah, that's a great question. And as was mentioned earlier in the panel, we know not just that mental health concerns have increased significantly this past year, but that also individuals seeking out services has also increased dramatically, in some cases quite significantly in terms of the increased percent of calls. And so what had already been perhaps an access problem has become much more magnified this year as people are seeking out the services and in need. I think one thing that I find really interesting about practicing in the Bay Area and perhaps the move this past year, the forced move of this past year with mental health, is providing services virtually. And psychologists and I think mental health providers in general were a bit reluctant for that shift. I think prior to COVID, maybe 20 to 30% of providers used virtual platforms to provide psychotherapy, and overnight nearly 100% had to adopt this service. And what that has done is creates, perhaps maybe not in this exact moment, but over time will create more access for people. Because now as a provider, I don't have to have a home where someone is coming into my office. I can see people throughout my state of California. And as more individuals are seeing people throughout the state, it could create access to people that are even in other cities via virtual platforms. The other thing that I've noticed is that there's been increased app use, and this is not the same as psychotherapy, but app use such as mindfulness apps, meditation apps, sleep apps, eating behavior apps that can help to introduce individuals to psychological concepts that can help with coping. And I think that the challenge with access is a real one. If someone has health insurance, they are able to go to their health insurer and ask about what sort of coverage do I have, who is in network. There may be a choice point around reaching people that are out of network. For those that don't have health insurance or maybe have very limited resources within their health insurance, I think it's much more challenging. And yes, there are these webinars that are now recorded that people might view, or apps, that sort of thing. But my suggestion would be to try to reach out to local community clinics that they have their feet on the ground, so to speak, in terms of those communities, and can help people to navigate where resources might be available to them. Another possibility is to work with or reach out to psychology or counseling programs at universities and colleges, because they oftentimes do provide services at lower fees in training clinics. And that can be a way to enter into a mental health system. Another thing could be, of course, to reach out to your network, to your family, your friends, your medical providers. And for those that have more access, I would say searching online directories, something like Psychology Today, or searching local or larger organizations like the Psychological Association. They will have listservs where individuals are listed in terms of providing services. But I think the issue of access is a big one. And I hope that over time, individuals who are in need will be able to continue to receive these services, especially as virtual services become more accessible. And perhaps at some point we can provide services across state lines too. That would really open things up more. But I think like a key takeaway for me is not to give up. I think, it can be a frustrating process, and persistence is going to be necessary for most people in this process. And to try to have multiple irons in the fire if you can, really trying to be as persistent as possible.
Well, and Dr. Wallace, I want to go back to you because we're talking about removing barriers, trying to get access to care. What about stigma? I know that's something that we've worked really hard at ABC7 to be really open and honest, especially this last year, about mental health struggles, acknowledging when people need to see a therapist. I've seen a psychologist in the past couple of years. It can be really helpful when you or your family's going through a hard time. Having those conversations. What's your take on where we are now with removing the stigma of mental health issues, disease, or just seeking help?
It's me every time. It's really interesting, with the stigmas, because, in spite of all of the efforts that we've made to increase access and all of the attention that's been placed on the mental impact of dealing with COVID over the last year and few months, there are still those stigmas that hinder folks reaching out and seeking out professional services. And so stigmas are kind of those negative attitudes that have been attached to, a situation or people, and it's specific to mental health care. Stigmas are around, what it means to have a mental illness, or what it says about you to seek out professional treatment. Unfortunately, it's often stigmas that prevent people to accessing care when it is available. And so as a result of that, we see worsening of symptoms. We see, a decrease in the likelihood of positive outcomes. And so I think the most important thing to understand here is that talking about your emotional health and normalizing the experience of taking care of your emotional health will increase the likelihood of people who are in need actually going through the steps to seek out and acquire the services that they need. We see stigmas that are, kind of culturally bound, right? So oftentimes in communities of color, there's a preference for kind of culturally sanctioned means of coping. And so, the stigmas that often prevent people for seeking out care is, if you are having issues with your mental health, what is that saying about your spiritual practice? What is that saying about your commitment, right, to your religion? And so we're kind of combating those stigmas from that angle. We're also seeing stigmas around, again, what it means to have a mental health issue. And so many people are kind of fearful of being labeled as being, crazy or having to take medication and what that medication is going to do to you long term. And so, it's kind of an ongoing battle, I think, just fighting against those stigmas. Oftentimes, when clients are coming in, one of the first things that they're asking me about specifically are those stigmas, and they'll start conversations with things like, Dr. Wallace, I'm not crazy, but, and so that becomes a part of that kind of initial process of connecting with the client, is combating those stigmas and normalizing the importance of good mental health.
Nobody is happy or stress-free all the time. I think mental health is something that affects 100% of people on a daily basis, or maybe at points throughout your life. I do want to keep us on track time-wise because our next segment is for tips for families. But Dr. Cascio and Dr. Lamar, I do want to give you an opportunity to weigh in on, removing barriers or cost issues or other challenges that you're dealing with as we move forward into whatever our new normal is. Either of you can jump in.
Well, I can jump in. Mine might be moving more towards tips. I don't know if you want to go, Ramsey. You want to go first? Okay. Well, so I was just thinking a lot about kind of moving forward and what that looks like for moms, especially because, again, I'm going to echo a lot of what Dr. Kent has already talked about, but I, think about moms who are, especially those who are working and are managing professional and personal roles, and how all of that fits into our lives, and how much that really adds to our mental health concerns. A lot of prior to COVID even, moms do a lot of the emotional and mental labor for families, and that can just add so much already to your plate. And COVID has just really added to that. And mental labor being things like, you know, you're the mom, you're the one who's kind of in charge of the calendar, and you know who needs to go where, and who's having, you know, what's due for this kid this day, and who needs to go to soccer, and I got to go to take this kid to the doctor and remember all of their symptoms that they've had for the last week. And, you know, kind of doing a lot of that task management in addition to, you know, keeping things sort of in track. And like, you know, my daughter just walked in this morning, was like, where's my computer? You know, things like that, like that I'm the one that she comes to find those kinds of things. That's all of that mental labor that moms are managing on top of all of the other pieces that they're doing. And that's going to continue. And it's hard for us to know what that's going to look like as we move forward, because we just don't have a sense of what anything looks like moving forward. And that emotional labor, you know, as kids are transitioning back into school and are missing out and are feeling isolated or separated from their friends and their social communities, you know, moms are taking on a lot of that, being aware of emotionally what's going on for our kids and having to sort of manage all of that, right? And that can be really challenging, and figuring out how to do that. Again, a lot of that's not that, you know, that parents aren't taking that on together, but it generally falls a lot to moms to do that stuff. And then I think about, you know, Jamie talked about like the, you know, replacing the loss of normalcy. One thing that I've seen, and again, this isn't new to COVID, but it feels intensified with COVID, is sort of trying to replace normalcy with making magic, right? And so moms have I just watched this like on social media, and watch this with, you know, in various communities, watching moms just doing all of this work to try to make things, you know, fun and magical for their kids. And just as a personal example, I had a friend, a dear friend, ask my kid the other day, like, oh, did you set a leprechaun trap for the leprechauns on St. Patrick's Day? And I just looked at her like, oh my gosh, I'm just like putting clothes on kids, making sure they have food in their bellies, and trying to get a full week of work in if possible, which has not happened probably in over a year. So no, I didn't gather up materials and make a little leprechaun trap. Like that's just not in my capacity right now. And, you know, go for it if it is. And if that's your thing, I certainly have my own things that are important to me, you know, but it felt so overwhelming. I was just thinking about the holidays and like people hiding elves and fairies and, you know, just trying to make like holiday magic for their kids. And I understand, and that comes from such a good place. And it can be such a point of stress and anxiety and of feeling like you have to make this experience one that kids will remember in a good way, and they won't remember the stress, and it becomes a stress on parents and moms specifically. And so I think moving forward, how do we think about how we take some of that stress off of moms, and for moms thinking and parents thinking about, you know, what choices can I make that work for me, not just for my kids. It's not only about, you know, helping your kids. It's also about this has to work for me and my mental health as well.
Dr. Lamar, I also did not have time to make a leprechaun trap, so I empathize with that. All right.
I loved looking at the leprechaun traps on social media. Just that wasn't my thing to take on this year.
Yeah, I also felt a little pang of guilt, and then I was like, you know what, we've got to move on. All right, let's move on to our next segment, which is tips for parents for navigating this road as we move forward. So Dr. Cascio, I'd love to hear from you. A lot of kids are back in school or going back to school, which is great news for so many families and kids out there, but it's also this strange transition after being at home for so long. So what are your tips for students and parents as we enter this next phase?
Yeah, it's a great question. And you're right. A lot of parents are ready for this. They're ready to have some space and get their kids back into school. And we know that the structure and predictability of school is actually really good for kids. A lot of experts think that this is a really great thing. You know, the worry that some of us have is, while this is a really great big step into sort of normalcy and getting some structure back, we do fear that some people see this as the panacea to things being okay again. And the reality is that kids are going back, and school is not going to look the same as it used to. And so there's going to be probably a protracted period of just readjustment and recalibration for both kids and parents. And that's going to take some time. The other thing to also know is that there is a significant group of the population that's really not very comfortable with this going back to school and the safety around that. We have to understand that. And Dr. Wallace talked a lot about communities of color. They've been disproportionately impacted by COVID. Also due to historical systemic racism, they've struggled with whether to get vaccinated or not, and some reluctance around that. And so there are some communities who are not, we're asking them to put themselves at greater risk, in essence, to go back to school. And we really have to understand that for some families, this is incredibly painful and uncomfortable, and have to have a lot of compassion for that. I think when we think about the ways to help young people and parents get comfortable, is to communicate and over communicate, particularly around what school will look like and will not look like based on what young people remember. So really actively have conversations with the school districts, with the schools themselves, about what is school going to look like for young people, especially when it comes to health and safety measures. What is in place in the classroom, at school, that's going to help keep young people safe and their families safe. And those need to be rich conversations with young people, developmentally appropriate, so that young people feel comfortable going back to school and parents feel comfortable sending their kids back to school. So I think those conversations are going to be really important. I think for young people too, also recognizing that the transition is a bit challenging, and for especially kids who run on the high anxiety side, talking to them and reassuring them about the safety that's happening. And we in the field talk a lot about reassurance versus rescuing. Reassurance is really helping young people understand that they're going to be safe and that the environment is safe, versus pulling them out and rescuing them from those experiences. The other thing that's good to do is identify, for young people, help them identify a trusted adult and or a space at school that they can go to if they're feeling anxious, if they're feeling dysregulated, that is a pre-identified place. And that those are conversations also to have with teachers about who is that person that my child can go to if they're feeling scared or if they're feeling dysregulated. We also talk and teach young people relaxation exercises and breathing exercises. If you talk to any mental health professional, or even just go online and look up breathing techniques, you'll see really great ones. One is called bubble breathing, another one is called box breathing, that you can help teach kids before they go into school, so that they can have some real concrete coping strategies as they enter an environment that may be a little bit stressful for them.
Thank you so much, Dr. Cascio. And Dr. Wallace, since Dr. Cascio brought some of your concerns up, maybe you can address that. What can families, communities who are feeling anxious about this transition back to school do? Is, especially as more people get vaccinated, but that hasn't been the great equalizer yet that we've hoped for. What's your advice?
I think it's important to have those conversations, as Dr. Cascio has suggested. So families need to sit down and have conversations about decisions that are going to impact the family. I think it's really important that parents normalize feelings of anxiety and sadness and distress, related to some of the decisions that have to be made. Oftentimes our children are more attentive to what we are doing than what we are saying. And so if we can demonstrate, acknowledgement of what we feel, if we can name it, we're giving our kids the language that they need to become more comfortable with expressing their emotions in healthy ways. Seeking out the facts. There are a lot of myths and, a lot of things that are being said about COVID, about vaccinations, about opening up our country. But it's important that parents, when they speak to their children, that they are having those conversations be based on facts. So that's going to require the parents to do a little bit of research. So, connecting with, trusted professionals, talking to your medical doctor, going to the CDC website and looking up information. And if you have questions, finding those resources that you can, connect with to get those answers that you need. I think it's really important too that parents have a plan. COVID really caught us off guard, and a lot of the things that happened, with regards to our schools and our places of employment, were made decisions that were made outside of ourselves, right? So corporations were making decisions, our government was making decisions, and those decisions directly affected us. And so it's important now that we are in a different phase, that as families, we sit down and we devise a plan as to how we're going to handle things moving forward. Now, that plan needs to be quite flexible, again, because we don't know what the future holds, but it's important that, our kids have a resource that they can go to and said, oh, mom and dad and I had a conversation about this, and this is what we said, our options for dealing with this particular situation. The older our kids are, I believe that it's, more important that we start including them in our decision-making processes as much as, is reasonable. And so talking about options with our older teens and helping them be involved in that process is not only going to help to, address some of the anxieties that they may be feeling about the unknown, but kind of looking forward, we're teaching them how to make decisions, intentionally rather than just on emotion. And so those are some of the things that I think are really important for families to consider.
Okay, thanks, Dr. Wallace. And actually, I'm going to sort of skip and start addressing some of the questions we've got from our audience, since I've got so many coming in. And Dr. Kent, we were going to sort of touch on this anyway right now. So parents and how they can communicate with their kids. Bindu is asking, how do we nudge parents to be open to counseling for their kids? Oftentimes the stigmas the parents hold on to prevent them from facilitating timely mental health care access to their kids. Also, on that note, what are conversation points? What are questions that parents can actually ask their kids at home if they're sensing some mental health distress, or just to keep track of their kids?
I believe it's important to be very direct. If you have concerns about your child, then you need to ask questions that are directly related to your concerns. I've noticed, son, that you're spending more and more time alone in your room and not wanting to go outside and play. And I'm wondering what's going on. Are you feeling sad? Are you having thoughts of hurting yourself? Are you worried about going back to school? It's sometimes the parent's own anxiety about broaching these subjects that increases the child's likelihood of not disclosing, right? And so then it almost becomes too late. So it's up to the parent to broach that conversation and to be very direct in doing so. And of course, there are signs that we should be looking for as parents. If we're seeing an increase in isolation, if we're seeing increase in sadness and tearfulness, if we're noticing changes in sleep or appetite, some moodiness, loss of interest in doing things that your kid previously really enjoyed, not seeming to care about things that were once really important, maybe giving away items as well. Those are some signs that we certainly want to take time to notice and have conversations about. We know our children better than anybody else. So don't get in the bad habit of comparing your child to someone else's. Well, so-and-so's kid did that too, and they were fine. Don't make that assumption. Check in with your child.
Dr. Kent, I'd love to hear what you feel and think on this matter too, in terms of both parents taking care of themselves at this moment in time, and then also effectively communicating with their kids.
Yeah, I think these are great questions. And I'll start with the kids piece just to build on what's been said. I know in my own life, I have a teenager, and I've found in the past, my ways of connecting with my teen aren't working right now. And so part of that, I think, is being creative as a parent and thinking about what are the spaces that I can create in order to have a meaningful conversation if you're feeling like the ways that you typically would communicate with your child aren't effective, or you're not able to reach them in the same way. And so for me, what had worked really well before was all the time I was in the car with him, because he didn't have to look at me. There was no eye contact. We were in the car for 10 minutes. It was very short, and we'd have really meaningful conversations in those 10 minutes. But that's been taken away during COVID. And so for me as a parent, now I've become really a great video game player. And it's a similar sort of experience where I'm on the couch with him playing the video game that I probably would have never played otherwise. But we're side by side, there's not as much eye contact, and I have great meaningful conversations. So I think as a parent, trying to really be creative and adaptive to what your child's needs are, and recognizing that the ways that we might have been able to reach our children before might not work right now. So that's one thing that I think it can be really helpful. I think in terms of parents, in terms of coping for parents, there's still a tremendous amount of uncertainty and a lot that parents are holding. And I know this may sound cliche, but we oftentimes talk about what do you have control over and what's outside of your control. And I think there's a lot of truth to looking at that. And with the pandemic, I oftentimes think about in therapy this difference between what do I need to accept versus what can I change. And I think when we think about the pandemic, that we can't change the pandemic. And so really trying to observe in your life, is there something I can change about what's happening right now? And if the answer is no, then moving more towards acceptance, trying to let go, trying to take a step back from it. And what I see a lot of times with women is a tendency to ruminate or to worry, to sort of spin over and over in their minds, playing out all the different scenarios. And so with parenting, that might look like, a young child who suddenly is having struggles sleeping, or perhaps it's a teen who is not engaging in their online classes and is lying in bed. And so the parent is really ruminating on this. And so I oftentimes will talk to clients about the difference between problem solving and worry. And it is natural to think through something if you're trying to solve a problem, but you may get to a point where you're starting to spin and you're going into this bottomless pit where you're playing out all the possible catastrophic scenarios, and that's no longer healthy to you as a parent and may cause you to feel worse. So really, I think sometimes even writing down, what is the problem I'm trying to solve? What are the steps that I can take as a parent to do that can help to sort of narrow in and contain that concern and help you to feel like you're taking steps to address it. I mean, I think another big piece, and this is echoing what was said before by Margaret, is just, letting go, returning to the basics, giving yourself permission as a parent to not feel like you have to be a superstar or be at 100% all the time. And I know that can be really challenging, but this is definitely one of those times where everyone is struggling in different ways. And it's really important to give ourselves permission to do the best that we can. And I think another thing, one last piece is humor. I think sometimes when we're struggling, it's fun, it's nice to find humor. And Margaret, I saw that before in you in terms of this leprechaun story. And I'm so glad that you were able to demonstrate that to all of us. For me, one of my children, I'm working at home, and every time I would go into the kitchen, it was as if an atomic bomb went off. And so I had to find the humor in that. It was not because there was a science experiment. It was because there was a desire to do something, I don't know, interesting in the kitchen that day. And that is the sort of scenario that I think as a parent, you could become extremely frustrated with, or feel like, oh gosh, one more thing on my list. I can't start dinner now that the kitchen is a mess. But just really trying to find the humor in things too, I think can help.
I love that. I think that's so important. We've sort of naturally transitioned now to the Q&A portion of this event. So I'm seeing questions come in. I'm going to ask some of them right now, but just for everyone out there, if you have a question, please try and get it in right now, because we only have about 20 minutes left for this event. So I'm seeing a couple questions from Marcia as well as Kristen, who are expressing some concern and anxiety about going back to school. And I know we've talked about this already, but I'm seeing it now from a couple people. Sometimes parents are uncomfortable because they may have health conditions within their home that make them more vulnerable to COVID. And sometimes kids, after being isolated in their homes, in their rooms for this long a time, don't feel like they're ready to go back to school and interact with their peers and teachers again. That being said, it seems to be part of our reality as we move forward. So how can we make that transition a little easier? I'm open to any of the panelists addressing.
Yeah, I always start with leaning on the science. What the CDC is telling us is that the transmission rate in schools is very, very low. It's a lower risk proposition. And really just leaning into the science. I think, knowledge is power. So, parents absolutely have the ability and the right to contact their schools and ask very targeted, specific questions about what is the school doing in order to ensure my child's safety and ultimately my safety as the child returns to the home and has potential exposure. And so I think leaning into the science, feeling empowered to ask the right questions, and just a tremendous amount of patience and flexibility. Also talking to the schools about possible alternatives and really just being open about readiness to return to school for either themselves or their child, and finding out if there are ways that the school can work with that family to do some sort of alternate hybrid model, maybe starting at, if the school starting at full days, maybe starting at half days so that the child and the parent can get acclimated and adjusted to the return to school. So those are a couple things that I would start off with.
And I'm getting a reminder now that we actually have just 10 minutes until 12:45 left in this panel. So again, if you have a question, please send it in right now. One question that I'm seeing from Stephanie is parents who are trying to keep their kids busy. She's heard, I don't want my kids to miss out, but kids are sometimes burning out because it's been difficult to manage school at home via Zoom. We know about Zoom fatigue and all of these extracurricular activities. I know I'm bombarded by emails from all of the extracurriculars, swimming, gymnastics, ballet, and there's sort of this anxiety about, oh my God, I need to get my kids signed up for everything because they haven't done anything for a year. How do we manage all of those new pressures? Dr. Lamar?
Well, I kind of just go back to things that have been said previously of, how can you do something that is working for everyone? If you've got older kids and you can do some negotiation about what it is that they want to do, what is their interest, what feels most salient for them, and figuring out how that works with your life and what you need. I think that goes also for kids that want to stay home. Is the possibility of that something that is overwhelming to you? Or does it feel like you need a break? I think there's also this sense of like wanting so badly for things to be normal that you feel like you have to make a decision right now. And I think that we have time to make that decision. And if you want to make your decision to return to school, you can do that in August if you're not sure how you're feeling right now. You can do that in December. There's never an all or nothing. I think there's a lot of options for folks. I've seen school districts now starting to add an actual virtual cohort for next fall, that they're going to just have a virtual option for some of those students who really thrived over the last year. And I think if that's an option and that works for a parent, then that's great. But I also think examining that decision-making process. Is this something that I'm doing because I feel guilty and I feel like I want my kid to be in a virtual learning environment for the next year, or that I want them to be signed up for all the camp? Is that coming from a place of, missing out over the last year and feeling guilty about that for my kid, or wanting them to have some sort of, childhood that looks in this ideal way that I think it should look like, or is it because that's something your child needs? And so I think evaluating that decision making process is going to be really helpful for parents, so that you're going into whatever decision you make, you're going into it knowing that you're doing the best you can with the information that you have.
Okay, I'm going to be very news producer-y with the timing here. We've got just 7 minutes left. So I'd like each of you to take 45 seconds to provide one tip, whether it's a conversation topic or something that you can do for self-care as a parent. How can we all move forward in a healthy way as families as we kind of leave this acute phase of the pandemic and transition into whatever our new normal becomes? Jamie, why don't we start with you?
Sure. Because I work with women, I've just seen them put everyone else in front of themselves this past year. And self-care is so important. And so I would, if I was able to write a prescription, it would be for each parent, not just women, but for parents to take, a few moments when they wake up in the morning to be intentional and decide, how am I going to care for myself today? And each day really think about, even if it's as little as 10 minutes that day, what can I do today to take care of myself? And I think if you're intentional about it, you're much more likely to execute on it. So that would be my one tip in 45 seconds.
Okay, and Dr. Wallace, what about you in 45 seconds?
I would remind parents that when the pandemic first hit, we just jumped into creativity mode. And we found all sorts of ways to try to fill our children's time. So we had game night, we had movie night, we baked cookies, we did all of these fun things. I would encourage you to find some of those things that you can continue, so that quality time with the kids continues. That would be my one tip. Don't let those fun things that you were doing during the pandemic that kept everybody going, don't let those things kind of go away, because we're getting back to normal.
Dr. Lamar, Dr. Castro, your turn.
I think as adults, children look up to us, and we have an incredible responsibility to model how to cope and also model our vulnerability. So as adults with our own kids, and maybe with students, if you're a teacher, to be able to talk about how you've been affected and the steps that you're taking to cope as a model for kids, that it's okay to talk about the stress. It's okay to reach out for help. And I would also say to parents that we are no longer a part of a generation that mental health support is just for those who are severely impacted. There are organizations like CHC and other community and private practitioners who are there to talk, to consult, pick up the phone, call, have a consultation. If everything's okay, the person will let you know everything's okay. And if not, that person will guide you in terms of next steps to take care of your health and your child's health. So take that first step and don't hesitate.
And I would just add that not to do it by yourself. I think if you're a mom or a dad, that you negotiate with someone to get support for yourself, because it's too hard to do this on our own. And that may look different within every relationship, but every day is a negotiation here. And I don't mean in a negative way. I mean, it's like, okay, here's what I can do today. Here's where my boundary ends. And my partner says, here's what I can do. Here's where mine ends. And we work out for, how we're going to manage the day or the week or the month. So I think doing that with a partner, if you have a family member or friends or neighbors who can support you in some way, or if you've got older children, figuring out how you can all work together to make this time manageable and to transition into the future, whatever that looks like.
Okay, thank you all so much. This has been an excellent conversation. I know I've learned a lot, and I'm feeling a lot better as we move forward. And I just hope that we can keep the conversation going through these type of webinars, but also just in our own community. I think it's helpful if we all just acknowledge that this has been a very stressful and challenging and anxiety-filled year. And the more we talk about it, I hope that we can, end that stigma and acknowledge that mental health is such an important part of all of our lives. So again, thank you. And thank you for having me. This has been wonderful and a great way to start my days before I head into work. So just so you all know, a reminder that this conversation will be posted in the coming days, I've been told. And we'll also be posting some resources for parents that hopefully you'll find useful. And the recording will be emailed to everyone in the next few days who signed up. And I'll also try and share it on my social media on Facebook and Twitter. So hopefully I'll have that up for more people to get access. And you'll be able to find this panel discussion as well as others that Palo Alto University have done in the past on the Palo Alto University's YouTube channel. So lots of places to go ahead and access this conversation. And if you have any further questions, you can feel free to email externalaffairs@paloaltou.edu. Thank you all so much for joining us. We've got about 1 minute left. If anyone has one last minute worth of advice or tips for people, whether it's about accessing care or having an important conversation with your family. I'm getting lots of thank yous. I hope that this has been really helpful for everyone today. And I hope that we can move forward and do what's best for ourselves and for our family. And yeah, for all the moms out there, take care of yourself. Thank you so much. I think that's so important that we take time for ourselves. Thank you.
Thank you.
Thank you.
Yeah.
Thank you.